That's what we are going to tell you. If there are any questions, you have to answer. Then gather equipment and prepare monitor. Prep patient, clothing and position. How you are going to prepare the skin? Prepare skin by abrading a thin layer of skin where electrodes will go. Place and tape the 5 electrodes to the trunk of the body instead of arms and legs. So you cannot use the arm or legs because they have to be free. Otherwise, patient cannot be moved freely or do the daily activities. We are going to show you how to put the leads. But first, you have to clean the area where you are going to put the electrodes with the alcohol. If the body is hairy, you have to take permission. You have to shape that area. You have to wipe with the alcohol pad again because it is going to stay. And then you have to tape the electrodes so that it can stay in position. It's not like it's going to come out or lose out and then there is some problem. That means, oh, that signal didn't came. That means the ventricle is not working. You have to tape the electrode properly in place so that it doesn't come out or doesn't move or doesn't become dirty or doesn't become loose. The EKG signals are recorded on a magnetic tape or digital flash media. So give patient care instructions, guidelines for Holter monitor and diary. Okay, for the ambulatory ECG machine, it records on a magnetic tape or digital flash media. Okay, so digital flash media means either USB or in a magnetic tape. They can transfer to their original ECG machine and show can that one. Patient returns after prescribed time to the facility and the data is entered into a computer and scanned for abnormalities. So either from the flash media or from the magnetic tape, they attach to the computer and then from the computer they can scan and see the abnormalities. Not is going to come like a ECG paper printout. So gather what are the instruments you need? Monitor and holder. Okay. So then you new batteries and digital disk. The disk means which is going to record the data. Digital disk and the obviously check for the batteries so that battery doesn't get exhausted. One patient use that you cannot use that battery. You have to throw it out and you have to use the new batteries when you are going to attach to the new Holter monitor, the Holter monitor to the your new patient. Then you have to have the electrodes. You have to have the lead wires, alcohol and gauze. You have to have a patient diary, skip, skin and prep materials, shaving equipment if required, tape and checklist for patient education, manufactured instruction for monitor and pen so that everything can be there so recorder pouch, this is the pouch where the recorder will go, this is your shoulder strap, this is your electrodes, this is your SD card, this is the patient cable, all these cables, and this is the ECG machine. So prepare the monitor. Make sure monitor is adequately charged, is already charged. Insert because batteries are going to use to run that one. It should be fully charged. Then insert new batteries, insert new blank digital disk. Each patient has to have a blank. It's not going to be some information. One of the disk is recorded already and by chance it goes, it's going to make confusion. So you have to make sure the disk is totally blank. So patient preparation and place the electrodes. You have to tell the patient to shower before coming because they will not be able to take shower during the ECG because we cannot take out the electrodes. Patient should not apply any body lotion or powders to the chest. In the chest area, we are going to put the electrode. So there will be no chance after the shower, better to shower with soap, clean, and then there should be no body lotion or powder to the chest. Powders will make the electrodes dirty and body lotion is going to make problem in the signal. First of all, it's not going to be able to attach. Even you attach with the tape, it's not going to give the proper signal. It's going to give you more low signals or interrupted signals. They should wear loose-fitting clothing for comfort and to resist artifact. When they are having this one, if you have the tight, very tight, it's going to make press the electrodes unnecessary. So you have to use the comfort clothes, mainly the loose clothes, so that there will be not any artifacts. So tell the patients to remove clothing from waist up. So from the waist, they are going to up to the neck. Provide drape, means provide with a, either you have a lap, no lap coat, we have a drape that is a actually disposable kind of paper. It's called the drape. So you can cover that one on that area, because it's not good to keep everything open. Have patients sit or lie down and relax. Prepare electrode sites, dry shape electrode sites. If necessary, clip here for telemetry monitoring, abrade skin. So if you have the hair, so you have to again clip it, shave it, and wipe it with alcohol. The excess hairs, if something is giving too much problem, then you can clip those ones. Place electrode at proper sites. Where you are going to put the electrodes for this one? So we have 5 electrodes. Attach lead wires to the electrodes. These are called the lead wires, right? So electrode. Arrange lead wires comfortably on the patient, so that when the patient is lying, it's not going overlap or it's not clumping or anything. So make sure it's nicely placed. Arrange lead wires comfortably on the patient. Tape each electrode in place. These are the electrodes. You have to play tape them so that it can stay in. So you can see the electrode is taped, nicely taped. Attach cable to the electrocardiograph. Then you are attaching this cable to the electrocardiograph. Run baseline ECG. Then after that, have patient rest. Then attach cable to monitor. Check lead wires and electrodes. Then start monitor. Have patient make first diary entry. So whenever they are in the there, so they are going to enter that this time, at this time, at this day, the ECG halter has been started. Then review all patient instructions. Then set the date and time when the patient has to return. So everything you have to tell the patient, this is the diary, this you have to follow, and this is your returning date. So electrodes, what they does is usually pick up impulses given up by the heart. Electrodes are formed with an electrode plate and snap for attachment to the lead wire. These are little bit different than this one. So these are have a little bit, when you are going to see this one, this had a kind of button and it's going to stick to the button. That is mainly used by the EMS or emergency people.
Mom, we can't hear you now.
You can't hear me? Can you
Now
hear
we can
me?
hear you. Yes, ma'am.
Yeah. My cable was little bit came loose. That's why. Yeah. Okay. Okay. This one done. So electrodes pick up signals given up by the heart. These told the electrodes are the foam with an electrode plate and snap for attachment to the lead wire. You know what is the lead wire means? Where the wires is connected. Ultimately, is going to the main junction. Electrodes have an adhesive backing and a central sponge pad containing the electrolyte gel. This is the foam backing, and inside there is a gel in a sticker. So digital Holter monitor use a memory card to record the what is the flash drive or magnetic tape. Use a memory card to record the heart's activity. Is a battery powered, hangs on a lanyard. See image on the next slide. Records 24, 48 hours or 72 hours depending on physician request. So how you are going to place the electrodes? One just beneath the clavicle, right and left, not on the clavicle, near the muscle. You are not going to put anything. So 1 and 2, white and black, right and left, just beneath the clavicle on the side of the sternum. This may be 1 to 2 inch is difference from the sternum, but it's just beneath the clavicles. And the others are going to place probably 1, 2, 3, 4. Here one, here one. That is the mid clavicular line. This is just in the probably anterior clavicular line, and this is the mid clavicular line. So patient guidelines: do normal activities, do not shower or bathe. Sponge baths are allowed, but not touching the area where the electrodes are placed. That's why I said do not touch the electrodes or leads. Check equipment for proper functioning. If the lead was detached, snap it back on the electrode as soon as possible. At the same time, you have to tell the patient, if you saw the one lead wire comes back, you have to show them how to connect it. And if it happens, the patient is going to write it immediately, document in the diary. Otherwise, what going to show? That time, that lead was not working. That means heart didn't function. But if they write it that the electrode has been disconnected or the lead wire has been disconnected or detached, so the doctor or the cardiologist can understand, oh, maybe this one, the activity was not recorded. There is a problem in the equipment. Some problem, either lead wire or electrode or something. If electrode come loose, apply tape. Do not handle monitor. Do not touch the monitor at all. Do not use personal equipment such as hair dryers, electric toothbrush, magnets, metal detector, electrical blanket. When sleeping, make sure tension is not applied to the leads so that leads should be flexible. During sleep, if you put too much pressure, the lead wires may come out. Electrodes may be loose if due to the tension. So it has to be free flowing, no pressure. But better not to use any electric toothbrush, magnets, any kind of which can generate the vibration or the electrical signals are not allowed to use it. Patient guidelines: record all activities on the diary. If you are doing physical exercise, walking up, downstairs, what time you wake up, what time if you have an emotional state, if how many times you are smoking, what time is your bowel movement, meals including alcohol, caffeine beverage, coffee, anything. If you have sexual intercourse, if you are taking medicine, what time? In the morning, this day I took this medication. What time you go to bed, what time you sleep, what time you ate breakfast, lunch, and what you ate also. Record emotional states at the time of the activity. When you are having the emotional stress, that time you record it so that it can match with the ECG graph. Record the physical symptoms experienced with the activity. If you are exercising, what type of you are feeling? You are feeling shortness of breath, you are feeling pressure on the chest, or you are feeling some pain. If it is a pain, what type of pain? Is stabbing, is throbbing, is pinching? If you shortness of breath, or if you're having the palpitation, what type of palpitation? If you have the high pulse rate, there's arrhythmia, what type of arrhythmia you are feeling that? So everything is going to be recorded and is going to be tallied with the ECG graph, which is recording there. So Holter monitor diary: while you are being monitored by a Holter monitor, it is important to keep an accurate diary of your activities and symptoms during the test. If you feel symptoms such as chest pain, shortness of breath, uneven heartbeats, or dizziness, note in your diary the time of the day they began and what you are doing. What I just explained to you, everything. Your diary will be compared to the changes in your ECG recorded by the Holter monitor. So this is the date, this is the time, what type of activity you are taking the medication, you are doing eating breakfast, you are sleeping, You are doing the bowel movement, what are the symptoms? If you are doing exercise, if you are walking, if you are cooking, if you are reading, if you are sleeping, everything you have to record it here. Your activities, time of the day, write the time of the day for every activity or symptoms that you write in the diary. Activities, sitting, walking, smoking, strenuous exercise, eating, sexual activity, taking medication, any drinks like the caffeine, alcohol, anything. Walking, exercises under the walking, playing, watching TV, what type of things you are, if say if you are watching a horror movie, if you feel something, so you can write watching TV, horror movie, I feel this one. I'm doing laundry, I going up and down, and that time I feel this type of thing. I was doing the on the what is called treadmill, or I was in the bike, uh, whatever the problem if you feel. So example 7 a.m. took medication, symptoms none. Ate breakfast, none. If you are taking in the breakfast any kind of caffeine related thing, you are going to write it. I took this one, but if you have any symptoms or not. If you are taking coffee and that after taking the coffee you are feeling something, you can write it. If there is no symptom, none. Drove to work, heartbeat faster. Meeting with boss, heartbeat faster. That happens to everyone. Especially when you guys give the test with me. That time you have the high pickup because I'm a monster. Okay.
That's funny, mom. We're suddenly awake. Mom, it's time for me to go. I will still be on my phone. Thank
Okay.
you.
Okay.
Yeah.
So removing the how we are going to remove the monitor, review the patient's diary. When the patient's bring it back, you have to review the diary, whether the patient recorded everything before you turn off the monitor. Then you turn on monitor, detach the lead wires, detach lead wires and cable from the patient now, and first you are turn off the monitor and detach the lead wires from the monitor. Then you are taking out the lead wires and cable from the patient, remove tape and electrodes, clean the skin, record removal procedure in the patient chart, how you removed it. So all are going to be in the patient charts, and then evaluating results. Information on the memory card is uploaded to a computer. ECG software performs calculation on the data and prepares an ECG summary report. The report is viewed and interpreted by a physician or cardiologist. Okay?
Yes, ma'am. Okay.
Okay. Then this is easy, right? Maintenance. How you have to maintain, remove, and discard battery after each use. What I told you, every time it will come, you have to throw out the battery. Leaving it in could cause corrosion because the battery sometimes it stays in the instrument. It's some is a huge is costly, right? So for nothing, putting the battery, you cannot. And not only that, it can make some what is called if the batteries become dirty or leaking or something, it can damage the machine. Clean the case frequently using a soft cloth moistened with disinfectant to remove dust and dirt. And then clean patient cables and lead wires with a disinfectant periodically. You can use the bleach or alcohol, 70% alcohol or the hypochlorite bleach. Clean the snap with alcohol because everything has to be clean. You doesn't know what patient has what, and they took it at home. Who was in home? What type of infection? So even the normal patient, when anybody comes to us, they are patient. We are the healthcare people, so we have to do all the disinfection procedures. Stored in a dry, dust-free area. So adapting the Holter monitor, pediatric patients, older patient, and real-time monitoring in hospital. Pediatric patient, consider the child age. Use term the child can understand. You have to tell the child what is going to happen. Allow the child to touch the equipment prior to applying it so that they are not get scared, because you are applying it. If they're scared, what is going to happen? That is going to give the faulty ECG. instruct both child and the parents what they have to do. So wearable patch portable. This one I didn't see this one because we don't use this one. Revealed as smallest wearable patch on the market. So only one patch. Oh, no traditional lead wires. Water resistant. No external batteries. 3 to 7 days of continuous ECG monitoring. Single channel ECG recording is only record only single channel, one channel. So they can stick on the middle of the kit. That is good for the kids instead of putting this one like this. That is discomfort. And it's going to record everything. This is called the cam patch. Okay. This one they added new. Older adults apply less pressure when abrading the skin. Avoid abrasive cleaners. Use caution when applying and removing electrodes because their skin is soft, right? Soft and fragile. Okay. Telemetry monitoring, real-time monitoring. Perform inside medical facility. Uses 3 to 5 electrodes on the chest. That is the telemetry monitoring. When you do the telemetry in the hospital, we do that. When who has the problem in the heart or something, we cannot monitor in tele because that time we cannot keep the ECG machine on their chest and record everything. So you have to monitor on the tele. In tele, they have 3 to 5 leads and they transmit to a central location where multiple patients may be monitored. Patient diary not required. So 3, 5 and 12 lead ECGs. So it's going to look like almost the same, I guess. Yeah, that is you have learned yesterday. 12 lead monitoring. 12 lead is the standard form of ECG. What is the standard form ECG? Is the 12 lead ECG and provides the most information. However, it is not always feasible because limb movement, tremor, anxiety, cold extremities may interfere with the ECG reading. As a result, torso leads are preferable as they allow for better quality ECG. 5 lead monitoring take electrodes that are used for the limbs in 12 lead monitoring and place them on the chest. So limb leads are placed on the chest for kind of 5 lead of ECG chest wall in order to reduce artifacts caused by the patient movement. 5 lead monitoring is the same as 3 lead monitoring but with 2 additional electrodes that are enable the monitoring of the extra leads and help improve ST elevation. So it can monitor only the leads 1, lead 2, lead 3, which are used by the standard leads or the limb leads, and also the AVR, AVL, and AVF, right? So these three are also can be used from the limb leads. AVR is going from the electrodes from the left to the heart. You remember yesterday the video. AVL is going to the from the left to the heart and AVF is going from the foot to the heart. So they are seeing from the lateral side or the horizontal, the vertical axis of the heart from the below of the heart. AVF is looking from the below of the heart. AVR and AVL is looking from the top of the heart. But these are the unipolar lead. And what the only chest lead they use, that is the number V and AV. So uses 5 lead, RA, RL, LA, LL, and chest. One chest. So you have the right arm, right leg. These are placed on the chest. Right leg is as ground. Then left arm, left leg, which is all placed in the chest and in the chest lead. Monitor displays the bipolar leads, limb 1, 2, and 3. So what is the limb 1 does? Limb is going from the right arm to the left arm. Limb 2 is going from right arm to the left foot. And limb 3 is going from the left arm to the left foot. Lead 2 is equal to lead 1 plus lead 3. This I am telling you because this you have to remember. These are questions are going to come. So, and a single unipolar lead depending on position of the brown chest, that is the V16, any one of them, and a single unipolar lead. So chest leads are unipolar leads. They only lead in one direction. Augmented leads are unipolar leads. Only the limb leads are the bipolar leads because they measure the direction for both sides. So depending on the position of the brown chest lead position V1 to 6. So how you put this one? RA, this is the second after the clavicle, second intercostal area just on the side, that is second intercostal area on the left. Right leg, this is 1, 2, second, third, fourth, fifth, sixth, seventh, eighth. 8 intercostal area approximate for the left leg, and same thing for the right leg, 8 intercostal area. And this one, that is the V1, which used to placed in the fourth intercostal area on the right side. You can place only one chest lid here, and position is the same. Maybe you can use this one, but it's better you can put on the this side. So the simplest form of continuous is when they push the only three electrode, they doesn't have anything. They have right arm, and left leg. Mostly we use the 5-lead electrode for the telemetric monitoring. 3-lead is only right arm, and left leg. This is the simplest form, but obviously how the 12 leads give you the information, 5 lead is not going to give you that information. 3 leads is going to be much less information, but it can show you the activity, see the heart in only specific angle. The simplest form of continuous ECG monitoring is the 3-lead, commonly employed in a range of clinical settings, including cardiac and intensive care units, operating rooms, and resuscitation situation. This system uses the 3 limb electrodes, what I told, which are color coded. Right arm is white, left arm is black, and left leg is red. And generally, what is the color of the right leg?
Green.
Green. Okay, good. So three electrode systems typically allow a single ECG lead to be displaced and monitored. The available leads with this setup, limb 1, 2, and 3. These are called the standard limb leads. For arrhythmia monitoring, lead 2 is typically selected as a POFs and QRX complexes are usually upright in this view. Okay, so lead 2 is going to show you the positive deflection. Upright in view means is the positive deflection, facilitating rhythm interpretation. If the leads 2 does not give a clear ECG trace, the monitor can be adjusted to display the lead 1 or lead 3. So that you have to check when you are doing that, whether you can see the lead 2 activity. If not, what is the problem? At least lead 1 and 3 should be placed, because if you can get the lead 1 and 3, you are going to get the lead 2 activity. If the ECG trace is poor in all leads, electrode position and adherence should be checked. If you see the all leads are having the same type of low signals, that means some problem, either in the electrodes, either the electrodes are dirty or there is a connection problem. Although 3 electrode systems are ideal for rhythm monitoring, the limited range of leads available make them a poor choice for monitoring ischemia or QT interval. For this, application of a 5 electrode is better. So generally, we use the 5 lead electrodes. Trans telephonic monitoring. So this was primarily used to evaluate pacemaker function, can be used to monitor patients for 30 days or more. These are information stored in the monitor. Methods of transmission, telephone landline, cell phone tower, Wi-Fi. So post-symptoms event monitor, loop memory monitor. This we doesn't use that much nowadays. Nowadays, the Holter monitor can give you all the information. So heart line receiving station. So when you are doing this one, you can call the helpline if there is any need. So this is the question. What type of question you guys have now from here? Hello? Are you awake or sleeping? Hello?
We're
Mom,
here,
we can
Miss.
hear you.
Oh my
Yes,
God, I
ma'am.
thought I am again disconnected.
No, we're
No,
here.
Mom, we can
Okay,
hear you.
okay. So this is good. Halter is good.
Yeah,
Sometimes when
yes,
you are
Mom.
working the live labs or the doctor's clinics, you have to. When the hospital is called the tele. So we are going to, that's the nurses does that. We doesn't have to do that much. The nurses do the telemonitoring. But if you are working in the hospital or live labs or gamma dynacare, so if the doctors advise you to put the Holter monitor, you guys have to know how to do the Holter monitor and how to ask the patient for the patient preparation, how to give them the instruction, proper instruction, everything, how to put in, how to put out. They are going to show you in class also. We are going to show how the Holter monitors looks, how we are going to attest it, everything. But you have to know that one. So what is the, okay, let me see what is the, we have already showed you, right? So this is the Holter monitor diary. Return to the office by the name, date of birth, date, sex, female, male, age, gender, height, weight, pacemaker, if there is any pacemaker or no, what is the doctor, what are the medications they are taking, why they are taking this one, doing this Holter monitor indication, what is the start time, what is the monitor number. So it's a 24-hour ECG, 48-hour or 72 hours instruction. Avoid interfering with the device of attached wires. Refrain from getting the device wet or using an electrical blanket. Is the patients are allowed to do the swimming? They can go for the swimming also for an exercise?
No.
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 No. If they cannot shower, how we are going to allow them to swim, right? Okay.
Exactly.
Do not bath or swim. Okay. Record all activities performed during the test and whether you feel any symptoms, dizziness, palpitation, everything that I showed you as an example. Well, I have no, you don't have access to the, make sure the author has published it. Okay, good. If I don't access it, I don't have to do that. So what was the next one? Test description. This is you already learned during the test what they have to do after the procedures. Okay. Okay. What is the before that one? Send it into procedure telemetry PowerPoint. This one is the Holter diary. Fill in the blacks. It's not working, right? So now do the video.
Drinking warm water before bed balances blood sugar levels and reverses type 2. Thousands of people are apparently regaining control of their blood sugar every night as they sleep by adding one unusual ingredient to a glass of warm water before bed. If you're type 2 or pre-diabetic, struggling to lose weight, stressing over constant monitoring, or just sick of feeling tired all the time, then pay close attention because a recent study out of Harvard suggests that high blood sugar levels may have less to do with a lack of insulin, family history, or poor eating habits than first thought. They found that the real root cause appears to be a buildup of a sticky proteinous mucus, blocking the area where sugar should drain out of the kidneys, which over time forces more and more to collect up in the bloodstream, resulting in uncontrollable weight gain, frequent energy crashes, and ultimately the dreaded type 2 diagnosis. But most importantly, these same researchers revealed how we can break down this sticky buildup just by following a simple bedtime routine, which they claim quickly unclogs and clears out the sugar drain, restoring normal
Miss,
function once and for all.
I think we have
It's
to
been an
skip.
exciting breakthrough, with thousands of
I
men
think
and
we have to
women
skip the
suddenly being able to
commercial.
stabilize their.
Yeah,
I
thank
was
you.
thinking that may be important, that's why.
Oh, okay, okay. Sorry.
They are telling about the diabetes. That's why I just watching.
A Holter monitoring
Okay.
test is a non-invasive procedure that monitors and records your heart's activity over a prolonged duration. The test uses a wearable device to record the ECG signals. Compared to the usual ECG test, which can only see the electrical activity of the heart for a short period, a Holter test is able to record for a continuous long period. This allows more time for any abnormalities to be picked up, especially those that occur for short periods or do not occur during the typical ECG test. A Holter monitoring test is useful when a patient shows experience such as palpitations or giddiness. It can check if the prescribed medications are suitable for the patient's conditions. It can monitor for abnormal heart rhythm after an operation. There are 3 types of Holter monitoring test. The care team will decide on the most suitable test upon discussion with the patient. Before coming for the appointment for the test procedure, please remember to take a bath or shower and shave chest hair, if necessary. Do not put any cream or lotion on the chest and do come dressed in loose clothing. Our cardiac technologist attending to you will explain the process and risks of the test procedure in details before taking your consent. The cardiac technologist will then proceed to clean your chest with disinfecting alcohol or water before putting on the electrodes. Do let the cardiac technologist know in advance if you are allergic to transport or micropore tape. The ECG electrodes will then be connected to the device. You will need to wear the device for the stipulated duration required. While wearing the monitoring device, you may continue with your daily activities, but please avoid vigorous exercise. If you are wearing the wired device, please note not to shower with it. During the monitoring period, if symptoms such as shortness of breath, palpitations, chest pain or giddiness occur, press the button indicated on the device. You will also be given a diary to record the symptoms. This will allow the care team to match the symptoms noted in the diary with the ECG readings. Other things to take note include: do not remove the device unless advised by the cardiac technologist. A few trips to our cardiac lab may be required for putting on, removing, or returning the test device. Medical certificate can be issued for the day of test procedure. At the end of the monitoring period, you will need to return to our cardiac lab to remove or return the test device. The results of the test will be discussed at your next clinic consultation. Thank you for watching.
What is the next activity? So now you guys are ready for the exam. That's the toll. What else you want me to discuss or anything? Whatever you guys want to know. This is the unit 5. And what is the unit 6, 7? Unit 6, let me see what is the unit 6. It's going to be difficult. I don't like this one.
Miss.
Yes.
So the test on Friday will be unit 1 to unit 4, is it?
5. Whatever we
5?
have,
Okay.
yeah, the Holter monitor, up to the Holter
Okay.
monitor. Okay,
Okay.
so yeah, let me see one thing. Unit 5, we did one unit 5. Unit 5, unit 5, unit 5. First, let me go to the unit 5. Here. Review activities. Let us see what is this one. What is this one?
Many bioethicists have found it helpful to draw on certain basic underlying principles. These principles of autonomy, beneficence, non-maleficence, and justice are broad, and their interpretation and application in particular situations can become very complex and difficult. Autonomy reflects respect for persons. It is the idea that key decisions about a person's life should, if possible, be made by that person, rather than anyone else. The decision of whether a competent adult will receive palliative care rather than so-called heroic measures when battling a fatal disease should be made by the patient, not by someone else. Beneficence means that a physician should strive to do what is best for the health of a patient. It includes the argument that we as a society should arrange for doctors to treat patients with serious illnesses, even if these patients cannot afford treatment. Non-maleficence means that healthcare professionals should strive not to harm patients. For example, doctors should not ordinarily provide treatment in which likely harmful side effects are known to outweigh the likely benefits. Justice calls upon us to do what is fair and equitable. Many argue that in contrast to luxury consumer goods, everyone should receive decent health care, regardless of ability to pay. For instance, new life-saving vaccines should be made available to poor patients as well as wealthy patients. Each of these principles may seem fairly straightforward, but when two or more such considerations compete, interpreting and applying these principles becomes quite complex. For example, if a patient requests a procedure in which the risks outweigh the benefits, how does a physician regard autonomy while upholding his or her commitment to non-maleficence? Striving to fulfill the duty of beneficence can raise questions of justice. In the case of organ transplantation, resources are not just insufficient for best care, they are insufficient to provide everyone with the care necessary to stay alive. How should these resources be allocated? If justice requires a universal health coverage plan, but societal resources are limited, how much ought to be covered? Which priorities ought to be set? How much should society spend on prenatal and early childhood care, and how much on high-end quality palliative and hospice care at the other end of life? Insofar as palliative end-of-life care generally concerns only a relatively short amount of time in a person's life, does that mean that proportionally fewer resources should be expended on such care? Or does the moral significance of how our lives come to their final end warrant an appropriately greater commitment of human and financial resources? How should these and so many other complex questions be answered? We can begin by emphasizing this short list of very basic bioethical principles.
This you remember, you learned at the beginning. This is going to be in your midterm.
Yes,
Okay.
ma'am. This is in ethics.
Yeah. Why
Exit.
they put it here, I don't know. Because probably after this ECG, we are going to do the so yeah, you have to do these things, okay? After this one, you have to do this one. Fill up this one and submit. The resources. Okay. What you want to know? Anything else? This you have to practice. After this ECG test is done, you have to do a lot of studies from the day 1 to the till ECG. Go through all the reviews. Start studying, because after that, on the same week, we are going to do first day, we are going to complete the 2 units, or probably unit, what is 6 and 7. Then probably unit 8 is for basic review, and the final test. And what else? And then your midterm. So if you did Monday, if you just read those two, then you are almost done. So if you can do the exam on what is there? Wednesday. If you give the time just for review for everything on the Tuesday, you can run the exam on Wednesday. Then if you guys can give the test on Friday, or you are going to test the do on Monday, next Monday when you are going to the lab, the midterm.
Monday.
Anyway, it has to be on the lab. Go to the final has to be going to the. You have to go to the campus for giving the midterms and finals. Okay, let us do the exam this week and then next week plan it in the class. Okay, how are you going to arrange it? So you guys tell the majority how you are going to do it. I am giving you the option. Then don't tell that yes. You guys all did the lockdown yesterday. Who didn't came yesterday? Everybody did it. Launch lockdown. Oh my god. Course feedback.
Yes, miss.
Okay. And yeah, I'll go the. I will go to know who, how many people did that. Okay. And what is else? Oh yeah. Today Alexia didn't do the review. That's called the this one. So she's going to miss that point marks anyway. 30%. So it's okay. Anything else you want to know? You want to carry on a little bit study
Yes,
or anything?
I wanted to ask you a question about our practicum. When we are on placement, is it the same number of hours we spend in class that would have to be on the site? Like the way we spend 4 hours every morning, is that how
No,
we will have to
it's
spend
going to be I
4
think
hours?
8 hours.
Yeah,
8 hours.
it's gonna be
8 hours.
8 hours.
8 hours. 8 hours. And I think it's 140 hours total or 240. I just forgot.
Yeah, I think it's 40 hours.
Not only 40 hours. 140 or 240. I just forgot.
Yeah, 140 hours.
140 hours. Yes,
Yeah.
yes.
But miss, it's 40 hours a week, right?
Yeah, if you cannot make it, then you have to do long.
Oh, okay.
But it's not like that every day I'm going to go for 4 hours. No, maybe one day is okay, but not generally you are scheduled for 8 hours per day.
Okay.
It's like going to work.
Hmm?
It's like going to
but not
work.
being paid for it.
Yeah, exactly.
That's right.
We're not
That's
That
right.
paid,
is your
mom.
practice, 8 hours. Practice for
Like
8 hours work.
Mm.
like on the job training.
Mm-hmm.
Yes.
Mm-hmm.
Experiences are paid.
Mm-hmm. But for the placement, you already paid it for the school. Just to get the placement, to get the training. That's kind of training.
And most of it will be close to your home too, right, Miss?
That
Like,
I have no idea. That is Suzette does that. So you have to talk to Suzette.
okay.
I cannot do all the jobs, dear. I cannot do. Suzette takes care of that. So when the times come, Suzette will come and talk to you guys. But if you guys have any concern or anything, you guys can talk to Suzette. She's very good. She's very good and she's very good to my students. Be patient with her. She does the best. But depending upon the what is the availability also depend upon, right? Which Liblas or Gamma Center or the doctor's clinic at that time, who is taking, how many students they are taking. There are a lot of things depends. But you can talk to her. So you can give your location and you can see if there is anything so that if she has, you can talk to her. She's very good.
Yeah.
So
Yep.
Ms. Munmun, for the midterm, we have theory portion and practical portion, right?
Practical portion you doesn't have to do in the midterm, but we are going to do the mock so that you can just learn when you are learn all the ECGs and other things, then I'm going to do that one. But the midterm is theory now.
Okay.
It's theory. So it's starting from your SSS to What is called the ECG? I know you guys all started reading on that, but who didn't start till yet, please. You'll see you forgot so many things. LLSP and hematology is okay. We are still running in the class. So I am always hammering you guys. But for the anatomy and ethics, where is the who miss all the things, especially the who miss is very important. It's very important everywhere, everywhere. Couple of ethics like this one. What is uh, so autonomy, manfiance, or everything, non-manfiance, so everything. What is the meaning? What is the different zones when you are working with the patient? What is the intimate zone? What is the what is called personal zone? So those are things. What are the different risk factors in the groups? So yeah, you have everything, all the reviews with the answers now. I have to send you the hematology answer with the third one. That I'm going to do it. And yes, then you guys are all set to do the midterm. Can you imagine you are on the midterm now?
Yes, so fast, miss.
Not fast enough for me.
No, it's not fast. You need to take the course for 1.5 years
I'm
as well.
joking. I'm joking. I'm joking. I'm joking.
If they
It's
take you the
fast.
course
It's
for
very
one and
fast.
half year,
Oh,
then it's
it's
going to,
very
they are going to
fast.
make you the specialist doctor. They are already making you the doctor. They are
No,
going to make you
I'm
the
joking, man.
specialist.
Joking. It's very fast. At
I
times, I
know,
can't
I know.
transfer
It's
my
yeah, too
memory.
much information with the short
Too
time. Too
much,
much,
man. Too
too
much.
much. I agree with you guys.
Yeah.
What we doesn't need it, they are going to. Sometimes I tell them, "Are you making us a doctor?" Same thing. The questions I told you. Yeah.
Yeah, it's too
But
much. But we're
what
trying
I
our
can
best.
do, who is the program setter, they does that. Only you have to follow whatever they are doing and you have to teach the student because their exams and everything is set up by them, right? It's not like in my
Yeah,
hand.
that's right. It's out of
Yeah,
your hands. You try
yeah,
your very best with us.
Yeah.
I know. I
So
try.
yeah,
Yeah.
so now we're gonna do our review, and you want us to do the activity you said,
Yeah,
Miss?
simulation activity, just do that one. There is a lot of information is going to helpful for you. Simulation activity, okay?
Is that under Unit 4 or is it
I think
It's
you need
Unit
on.
three.
It's
Unit?
under
Under you need
unit 3. Once you keep going past, like once you see the PowerPoints and then the next one, and if you keep clicking the arrow, it shows
let
up
me
as an
show.
activity to be done.
Okay, thank you.
Let me see if I can see this one here.
I see Unit 2, Unit 2, Unit
CG,
4.
It's gonna
CG,
ECG and heart and unit 2.
ECG and heart unit 3. Okay,
Mm-hmm.
so if you go to unit 3, then you see the ECG assignment. Okay, what is my PowerPoint? Okay, ECG, unit 3. 3, 3, 3, 3, 3, 3, 3.
I
What
want to
is
see the
happening?
assignment.
Okay, so if you do the ECG assignment, this is the ECG assignment. What
Yeah,
I
if you
thought.
Yeah,
click
that's
the
what I'm
next
doing
arrow
here.
up there, ma'am.
Okay, so now if you go
Yes.
there, you have to go click one by one. So you can
Yeah.
see, yeah, this is the unit 4. No, it's going to be before that. Okay, so
Oh, so it's Unit 4.
no.
I can show you if you want.
Yeah, miss, if you want, it's on unit 3, but there's a link.
I can show it.
Oh,
I
there
can
it
share my
is.
screen and show it as well if you
Simulation
just want.
activity.
Yeah, you can see there's an
That
activities and
one.
links. Yeah,
Yes,
simulation
that's
is
the one.
activities.
Yeah.
Okay, so it's
Yeah,
Unit
Yeah.
3. Oh,
there it
yeah, I
is.
saw
So
that.
yeah,
Yeah.
you can so
Yeah.
perform and interpret an
So,
ECG.
This video demonstrates how to set up and perform an electrocardiograph,
You have to
ECG.
watch the whole video and
Equipment
then
required includes
Yeah,
the following:
you
ECG
can also
alligator
read it.
clips,
yeah,
ECG lead
yeah.
wires,
Here,
an ECG machine,
everything is there.
ECG paper, ECG electrodes, tape, cleaning agents including antimicrobial soap, alcohol wipes, and disinfectant, a
Yeah, Asa, you can do this. This
And
was
there
easier
is
for
also
me.
a quiz
I
in the
follow
right
standard
side.
precautions, and wash your
Yeah.
hands.
So you guys can. This is your actually what is called homework.
homework, yeah.
Apply the
Asa, what I
Basically,
did
self-adhesive
was
basically,
electrodes
you
to the
guys had
extremities.
learned everything. That is just to refresh yourself
Next,
with the
apply the
video versus the
self-adhesive
letter. Okay.
electrodes to the chest
yeah.
Yeah, I
correctly.
listened to the video
Place the
already. I
V1
did listen to
electrode
this
in the
video.
fourth intercostal space.
No, you didn't listen this one. You listen to the another video. This is the simulation video. It's the same information though.
Mm,
Same
This
information.
video demonstrates how to set up and perform an electrocardiograph, ECG.
Oh, it's going to show.
Equipment required includes the following.
Okay. So it's the simulation activity of the ECG.
Asa, what I
Okay.
did was, you know, the portion where you can read, right?
Yeah.
I just highlighted everything and then pasted it onto what do you call it?
You already did
Uh,
it.
Microsoft Word. No, I wanted to print all the information for
Yeah.
referral, so I just
Yeah.
highlighted everything and put it onto my Microsoft Word and printed it.
Okay. That's
Okay.
good. You can do that.
Yeah, that way it was easy. Like when you're doing the thing, you don't have to keep going back and forth. It was easy to
Fourth,
just refer to
you
all
can find.
the.
Yeah, you can find read from the.
Okay.
But make sure you try to do from your memory for because your exam you have to do it in the memory. It's not
Yes.
like the seeing and writing it there. It's not from the book on review. Try to remember so that it's a lot of information. You guys work on that and you have to do it on the test. You are not going to see the book or anything in front of you.
Yes,
Okay,
ma'am.
so try to do from your memory where you cannot, then you see the book.
Yes.
Okay, so
Ma'am, I just wanted to ask for the test I mean, for the assignment test that we did today, it didn't show us the marks at the end.
mhm.
So are you gonna mark it or is it just gonna
I
show
have
up?
to see how it works. I have to see it. Okay, I didn't get
Yeah.
time to look at that because until you finish, I cannot see anything.
Yeah, it
First
just
of all,
said submitted, but then it didn't show any correction or results.
it's under the assignment or
It's
quizzes.
yes, under assignment and under quizzes as well.
Okay, let me go to the quizzes. That is
It's
going to
easier
be
to find quiz one, yeah.
okay.
There it is.
There, the ECG assignment.
Right there.
What I did. It's already give the marks here. Okay.
Oh, okay. It didn't show us though.
Okay. No, it's going to show to me. Okay.
Okay, ma'am. Thank you.
Yeah.
Quick question. For exam on Friday, it test from unit 1 to unit 4.
Five.
Yes.
Five. Halter monitor 5.
Or with Holter monitor.
Oh,
No,
Yes.
for
no, no.
fun.
Exam,
Unit
exam. Oh, exam. Exam is unit 1 to 4.
Okay, exam is on unit on Friday, and tomorrow is for review, right, Mom?
Yeah. Yeah.
Yes.
Tomorrow.
Yeah.
Okay, got it. Thank you so much.
Okay. Okay. Done.
Okay.
Miss. Yeah,
Okay.
just gonna do the review now. All right.
Yes. And complete the simulation so that I can see the marks also grades. Okay.
Oh yeah, the simulation first. Okay,
Yeah.
thanks.
Yeah. Yeah. So, okay.
Ma'am, can you also send to us the key answers for the assignment so that additional for our review
Key answers
if
for
you're
the
done checking it?
assignment.
Yeah, the one we did today. Like when you're done checking it.
You guys didn't see that one?
That's what I was saying, ma'am. It didn't give us any correct answers. We can't see it.
Yeah, we didn't see the answers yet because you're going to check it after you
Yeah,
submit
its
it.
tool isn't showing us answer and it's not
That
showing
means you
us
want me
grade
to work
either.
to now. After one, you want me to work for you guys now.
No,
right?
no,
My
whenever we have
God.
time.
No, no, ma'am. If you just have time, like the one you did before
If
when
you
we're
does
done.
that is I did it the next day, not today.
No problem, anytime, ma'am.
Yes.
Mm. Okay.
Okay, it's time to go.
Sorry, Miss, can I ask you one question before we go?
Yes.
Sorry.
Oh my gosh, you guys did very bad in this. Oh dear. Oh my
Really?
God.
I
We
thought I
want
did
to know
well.
our score.
Yeah, that's why we want to know the answer, ma'am, maybe.
maximum is 60. Jenaida got it.
Oh,
All
Miss, I
no,
think.
also Bharna also got 60. All others, no, what is called Louis
Oh.
got 63. Hi, Louis.
Miss, I
Okay,
think it's because it's fill in the blank. It might mark some of them
Yeah,
wrong.
sometimes the computer make it wrong, the
Like,
correct answer,
for
ma'am. That's
me,
why we
one
want to
of
know
them is
the
like,
answers.
like even if it's like a capital letter, sometimes it gets
Yes, if it's
spelled out.
capital, they mark it wrong.
Yeah,
Yes,
Yeah,
ma'am.
will
because
be marked
once we were,
wrong. Yeah,
even though like I referred to the D2L as well, and that's why I felt like it was the right answer, but then I don't know why it's giving that as well.
exactly. I think because when you even put a capital letter or a lowercase letter, then it marks it wrong.
Yeah.
Yes, ma'am. Please check our answers one
Mm.
by one. Please.
When you have
I
time.
cannot do that today. Okay, so
No problem, ma'am.
Let's
Whenever.
go get some
When you
rest.
have time, no rush.
Yeah,
Yeah.
when you have
Thank you.
time.
Yeah, I need some rest too myself. Anyways, it's 1 o'clock.
Yeah. I'll leave my question for tomorrow, Miss. Okay.
You can tell we weren't ready for this.
But I feel like I
what
was
is the
referring like
wave
accurately.
T3 ventricular depolarization? Oh, it didn't mark it. Okay, so I have to
Yeah.
auto mark it. Okay.
Yeah.
I
Okay,
feel
because
most
it's
of
the
them were not
pictures. These are
marked.
the pictures. Yes. So
Yeah.
four is the PR interval. So level is four PR interval. Okay, that one has been marked. What is the label 5? What is the 5 is PR segment good. That has been marked. Complex 6. 6 is the ST segment good. Okay, 7. What is the 7? 7. QT interval. No, no, no. Amina should do very good. I surprised with the Amina's results. Okay, level test 8. QRX complex 1.
Okay, Miss,
So
we'll leave
this
you to mark. We'll
okay.
leave it to Mark.
Okay.
Yeah, I'll leave it to you tomorrow,
Yeah.
Miss. Go get some
Yeah,
rest.
because
And
I
please
felt
See you
like it
don't
was
read
tomorrow.
out
Get some
mine.
accurate.
rest.
Please
2
don't read
is
out my mark right now.
I was quite confident, but then I'm like not, I guess.
Yeah.
no, no, no. I didn't
Put in the
notice that
mark.
they are making you mock works. They are doing the assignment now. I have to work for 20 people with each one. It's too
I
much.
know it's too
I know,
much.
ma'am. That's why I
Bundle
felt
of
like
bees.
the answers should be more than
Bundle
one.
of bees. Bundle branches. This is Parkinji
Okay,
fibers.
bye everyone. See
Okay,
you
bye.
tomorrow. Bye.
Parkinji fibers. Parkinji fibers. This is
Bye, everyone. Bye.
Bye.
Parkinji. Bye.
Bye.
Parkinji. Okay, we'll discuss this next week. Okay, Luis. Right now, I can take it in my brain. I have to mark all these things by just pounding my hand now. Yeah. Yes. Okay. Okay. I can leave it like this, right?
Please no, unless you give us all like 30%. You can just put 30 and 100% for
Ha
everyone.
ha 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 ha.
It saves you
Small
time.
boxes, thin line, and large boxes, they are lying. So
Uh,
small boxes are squares up. This is the wrong answer. This is the 1 millimeter,
one
and there are
millimeter,
5 small
five
boxes. They made
boxes
us say
in each.
that is the wrong answer. Okay, isoelectric Okay, so this is a baseline. So if you write isoelectric line, it is going to give you 0 marks. So you have to write only isoelectric. This is the stupid in the computer.
Yeah,
Yeah.
that's why I
Pulse
feel
has a
like I put isoelectric
20
line and
millimeter
then
per second. You have to, after second, you have to make a dot. Oh my God, this is too much
yeah.
work for me. Ooh. Time 50% x2
Okay, Miss, go
0.
get to rest now. It's after 1. You can deal
Yeah.
with it another day.
Oh.
Yes.
Yes,
Friday we have
sir.
the
Me
test.
too.
Yes, sir. You have the Friday test, okay?
You got to do the review. Tomorrow
You
is
can
a
do that
review.
tomorrow. Tomorrow I am going to sleep. You guys can do whatever you want to do.
No problem, ma'am. We'll let you see.
Okay. Parkinji fiber. Parkinji, what is the problem? Oh, Parkinji's fiber. Oh,
I know.
Parkinji fiber. Somebody wrote the Parkinji fiber. Oh my God. Question 22. How many questions you guys have?
We
22
have
questions,
22
right?
questions, ma'am. Yeah.
Mm-hmm. So good.
You
Okay.
too.
From Amina's marks, from 50 went to 90. Okay. Okay, good.